Well, hello everyone. I would like to just quickly introduce myself. I am Emily and I'm working for the City of Refuge currently. And today we'll be talking about kind of the medical terminology and words for patients to know overall, and kind of give an idea of maybe what types of terminology and words you could use or know for the next doctor's visits. All right, so in terms of medical terminology, there's certain root words and kind of suffixes and prefixes that can be very important. And sometimes you'll often see this in other words and professions. So, ology means the study of, and you can find this in different types of words that mean like different kinds of departments and kind of different specializations. And so plasty is a surgical repair. Rhea, it means flow and discharge. Dynia means pain. Rene or reno is nose. Ortho is straight. Pneumonia is lungs. Raphy is suture. Dermo and dermato is skin. Itis is inflammation of. And then there's also other words to know as well, and this will give you kind of fully a good overview. And gastroentero means stomach intestines. Oma is tumor. Ectomy and tomy means excision and incision. So the ec of ectomy is the X of excision. And there's also cyano, which means blue. Emia is blood or presence of blood. Osis is condition or status or disease. Pedi or ped is meaning foot. Cardio is heart. Milano is black and leuco is white. Site is cell. So here are some of the words that I came up with, the list that I just mentioned. And so, for example, there's rhinitis, which is itis is the inflammation of rene, which is the nose, so inflammation of the nose. And then plasty is a surgical repair. And reno, of course, is the nose. So O is just the combining word or combining letter. And so surgical repair of the nose. And then leukemia is leuc is white and then emia is presence of blood. And this is talking about, the disease leukemia, which there's happens when there's an issue with the white blood cells. So yeah, and then there's cyanosis, which of course osis is the status or disease, and then cyano is the meaning blue. So cyanosis essentially is the turning blue of your fingers, body parts, and whatnot. And it's really describing the condition that those body parts or the bluing of your lips, for example, is. So there's also gastrectomy, which gastro is the stomach, and then ectomy is the excision. So gastrectomy is the excision of the stomach area. And then melanoma. Oma is tumor. Melano is referring to the melanocytes, which are the skin pigments. And what usually happens is when there's sun and the melanocytes come into play, they help protect the skin from the UV damage and from the harshness of the sun, and your skin will turn tan. That's what gives your skin color. So the melanoma is essentially, skin cancer because it is a tumor within the skin pigments and skin functions. And so there's also dermatitis, which is titus, inflammation of, and then derma is the skin. There's leukocyte, which of course is essentially a white blood cell. So yeah. There's also different categories and specialists, and this list gives an overview of kind of a lot of the types of you know specializations from the healthcare industry, and usually sometimes maybe your primary care physician will recommend or refer you to someone, one of these folks in the list for different specific problems or conditions. And so, for example, there's dietitian, which helps with your diet and figuring out kind of a little bit of the nutrition wise, and then podiatrist, which is dealing with your feet, like ISTA's specialist in condition and such. Cardiologist is of your heart, so that's a specialist of your heart. ENT is the ear, nose, throat doctor, which they can do allergy tests and such, and they're working within those areas. Pulmonologist, of course, is the lung, and technically, I remember pulmonologists can also order the Challenger test, and so can the ENT, which is essentially, a test for testing for asthma. So maybe some of their tests and kind of their functions overlap, but they are separate doctors, and they are different. So orthodontist is essentially a teeth doctor. Ortho is straight and having like straight teeth. Orthopedic surgeon, of course, deals with the bones, at least the surgery of the bones. And then there's immunologists / disease specialists or infectious disease specialists. They work with your immune system and, also work with other infectious disease. There's the pediatrician, which is different from the podiatrist, and the pediatrician, of course, deals with children. And the ophthalmologist, ophthalmo meaning eye, and then, which is essentially the eye doctor. There's gastroenterologist, of course, the stomach and intestinal area specialist, and sometimes there's also surgeons who fall under this category, and they do things like sometimes bypasses or gastrointestinal bypasses. There's also the endocrinologist, which deals with the endocrinology of your body, or like kind of your lymph nodes and kind of different chemical responses and hormones and such. There's also the dermatologists, which is of course the skin doctor, gynecologist, and obstetrician. Obstetrician is for the female reproductive system. And actually, I remember learning the word gyno is another word for kind of, or the root word came from essentially a female flower. And so that kind of came into, the reproductive system, the female reproductive system, as you can imagine. It is similar, and that's kind of where the root word came from, essentially. And then so moving on, there's also different abbreviations that I think are also important to know. And it can, sometimes you will have records and like doctor's notes and such, and sometimes they might even, abbreviate conditions and such and what you have. And so these are some of like the common ones that I found, and it'll hopefully help you better understand what sometimes the scripture is saying. But there's COPD, which is chronic obstructive pulmonary disease, which happens. It's more of a well-known disease, and it describes a lot of. It's like an umbrella term that describes a lot of different diseases and conditions. There's also prescription, which is the R subscript X. And then there's also the F subscript X, which is the fractures. H subscript X means history. There's also things like the ICU, which is intensive care unit, which is, of course, you could find that in emergency rooms or the ERs. There's also CPR, cardiopulmonary resuscitation. Of course, you do this technique where you help the basically you help the patient resuscitate their heart or keep their heart pumping. It's the pushing of the heart and trying to beat for them essentially when they're out, and having this can be helpful in different events. And then Y/O is a year old. So these are some of the most common abbreviations. There's a whole ton of different other ones. But yeah. There's also different scans and testing, which, of course, I think that, if your doctor orders an MRI or a CAT or a CT, this information can help you understand what kind of testing you're getting or kind of what it's used for and its function, and kind of like what potential results that can come from these testing. So MRI is the magnetic resonance imaging, and it's used for like internal functions, for example, like different internal things, organs and such. And there's also different it can show different tumors, ligaments. It's also good for spinal and brain. And it can pick up diseases. So there's a difference between that and the CT. It may also be able to pick up some diseases and differences that the CT doesn't necessarily pick up. So that is good. And the CAT scan now we have is essentially, it's like a CT, but it's essentially the taking the photos in the X-rays and such in different cross sections. Axial, it's like just a different angle. And it's really, it does the same thing as a CT. It shows the tissues, bones, organs, internal such things. And then the ECG or the EKG is the electrocardiogram, and essentially just, records the electrical information or impulses of the heart, and it really only deals with the heart and the heart health. And so, like, things like you can probably detect heart attacks and other conditions and of the heart or heart murmurs, even. Although that heart murmurs, you can probably hear, the doctor could even hear it if they listen to the heart. So the EEG is the electroencephalogram, which focuses on the brain area, and it records electrical brain activity, and it can detect things like abnormalities and anything wrong with kind of the brain or something unusual. So both the ECG and the EEG does kind of the same thing, but in different areas of the body. One is for the brain, one is for the heart. So the CT is, of course, computerized tomography, and of course, as mentioned earlier, it's really X-rays of the internal organs and such, and it deals with tissues, bones, and organs. So yeah. So these are the different kind of imagings. The one on the bottom with the brain is the MRI. The like the blue colored, the multi. There's like 8 different imaging of the head. That's the MRI. There's the EKG or ECG on the top, uh, and it's the squiggly lines that measures the heart impulses. There's also the CT scan, which is you can see on the left hand side the big donut ring or the big, a donut machine, I call it, or the circular, you know, on the very left hand side. and the right hand side is also another imaging, and it is the EEG, because that is of course according to the brain. And with these different kind of colorations, you can probably see the internal structures and maybe potentially what is kind of um, wrong with the brain. It shows a little more, um, different things. But yes. And so there's other resources that you can do. I actually was led to this medical dictionary site through one of my classes. They put the link. So if you put the link in, this is just a site where there's different medical terms you can do. And it takes you to things like health categories, popular health centers, medicine net, and it also has different, health news that you can look at, um, and overall kind of different terminologies. There's disease and conditions, drugs, supplements, health, living, media, which I will show you. Yes, there. I think you can see it now. But yeah, there's different kind of disease conditions you can look at, drug supplements, and then health living. And then so there's also more information on here as well, like this. And there's also, of course, as mentioned before, different articles and things you can read and newsletters. So yeah, that's one resource that I found useful. And then going back to the PowerPoint slide, here are then my resources that I used. And then, of course, the imaging is found on Google Images online. So here you go. Well, I hope you enjoyed my little mini presentation, and I hope you did learn something to take away from your next doctor's, or to take away for your next doctor's visit, and overall understand kind of some of the different things and different words you can be faced with. So yeah. But yeah, here you go.